All right, thank you. Yep, thank you. All right, now it's my pleasure to introduce Liz Hamilton, who's the acting CEO of Bendigo Health, our partner, who's going to talk about why hospitals are so critical. Thanks, Liz.
Thank you for the opportunity to speak today. Evidence tells us that victims experiencing family violence commonly disclose to health professionals before they tell anyone else. And evidence also tells us that the first response of a health professional is pivotal to a patient's safety and support. Equipping health professionals with the tools and confidence to provide that safe and supportive response is ultimately the aim of the Strengthening Hospital Responses to Family Violence initiative. We need to make sure that our clinicians, our nurses, our doctors, midwives, and other health professionals have the education and support that they need to sensitively identify and respond to patients who disclose that they are experiencing family violence. Part of our work in the coming years is to make sure that health professionals across the state, regardless of which health service they work for, know how to do this. That is, we need to make sure our clinicians know how to identify the signs that something may not be quite right for a patient or for our staff. We need to make sure our clinicians know how to sensitively inquire and ask about family violence. We need them to know how to respectfully respond should a patient or staff member disclose that they are experiencing family violence, and we need to know how to refer that patient to the most appropriate support. Hospitals must improve what we're doing to ensure that we are not missing the opportunity to intervene early and prevent the violence from escalating. In a busy clinical environment, there is a chance that we could miss some of the signs or the indicators of risk that patients experiencing family violence may present with. We only need to be able to recognise those signs. We not only need to be able to recognise those signs, we also need to be able to ask the patient about their experience and to provide an appropriate response. Asking the right question at the right time can make such a difference to whether a patient is willing or not to disclose their experience, and our staff need to be confident in not only asking a patient about their experience, but also then being able and confident that they know what to do if a patient does disclose family violence. Knowing what specialist family violence services are available to support the patient and knowing how to refer to those services is vital to providing the safe response. In order to be confident in asking a patient about family violence, our staff need the right training, the right support, the right structures around them to be able to do this and to do it well. Family violence, as we hear regularly, is a significant health issue, and I really commend the Victorian Government on their investment in the health sector to enable a dedicated focus on strengthening hospital responses to family violence. Bendigo Health is incredibly fortunate to work in partnership with the Royal Women's on this very rewarding initiative, and we are very honoured to provide a rural regional hospital perspective. Of course, there are similar issues faced by all victims of family violence, but there can also be different challenges for those living in small rural communities, where small town intimacy can be both a strength, but also a barrier to the support of people experiencing family violence. So we are very pleased to be supporting other rural and regional health services across Victoria to implement the Strengthening Hospital Family Violence Service model and to share with them our learnings that we have gained over the past few years of this initiative. We are now at stage 4 of this important initiative, which commenced back in 2014. The SHRV service model was developed in stage 1 of the project and has been revised and refined over stage 2 and stage 3 as the Women's Hospital provided mentoring and guidance to implement the model at an increasing number of metropolitan health services, and Bendigo Health provided mentoring and guidance to regional demonstration sites in stage 2, and to 2 regional leads and 14 smaller health services across initially the Lodd and Mallee region in stage 3. The next few years will see the service model rolled out to all Victorian hospitals, with the Women's Hospital expanding their metropolitan service lead role and Bendigo Health taking on the responsibility of the regional support lead to support all rural and regional hospitals across the state to implement the model. Through this initiative, hospital staff will be better equipped to identify and respond to family violence in a sensitive manner, and to provide an environment in which victims of family violence feel safe and supported, a feeling that everyone is entitled to. This is the sensitive inquiry model that you'll learn more about today, and thank you.